So,
So
you go through the plan?
All right. So the plan for you today, Mr. Jones, you have two big problems that are why you're here. One is what we call COPD exacerbation. That's what you described earlier as your COPD acting up, being higher than it usually is.
Right.
So the plan for that, you've been getting the Duanebs every 4 hours. So we'll keep doing that as long as you need it and try to switch you over to inhalers as you're able. Okay? You're on the steroids that we mentioned earlier. That medicine's called prednisone. You're on 60 milligrams a day, but we'll be tapering that gradually over 2 weeks. So you'll be taking those for a total of 2 weeks.
Okay.
Okay? You're on an antibiotic called moxifloxacin at 400 milligrams a day, and you'll take that for 5 days total.
The antibiotic.
The antibiotic, yes. And in addition, as you're coming off the Duanebs and as we're getting you ready to go home, we'll be starting you on an inhaler called Spiriva. It's one that you'll take every day, whether you're having problems with your COPD or not. And it's a controller medicine that'll help prevent exacerbations like this. Okay? All right. And the other issue is your diabetes. So what we're doing for your diabetes today is we put you on a long-acting insulin and some scheduled insulin with each meal to help with tighter control, and we'll also be having a diabetes educator come by to help you out with that as well.
Okay.
So I know that was a lot of information I just threw at you.
Yes.
So to make sure that we're both on the same page with the plan, why don't you tell me what the plan is for today?
Okay, let's see if I can remember. 4 times a day I'm on a medication. Every 4 hours I'm on a medication for COPD.
Mm-hmm. That's the mask.
That's the mask I'll be taking to breathe. I'll be on some prednisone, which is a steroid to reduce the swelling in the lungs, I think.
Mm-hmm.
I'll be on an antibiotic for infection prevention, I guess. And then I'm going to be increasing the insulin for the diabetes.
For the diabetes. And also the inhaler that you're going to start taking every day
Right.
to help control your COPD.
That's different from the one I had at home?
It is. It's a new medicine. This is
Okay.
one that'll help control your COPD and prevent exacerbations like this in the future.
Okay, so it is different.
Dr. Brown, can we have order Readback?
Yeah, the orders I put in so far included starting, Mr. Jones, we started you on that Lantus. It's going to be 7 units at bedtime. We're going to be starting you on that Novolog, which is the insulin with meals, at 2 units with each meal. We also are going to have the diabetes educators come by and the respiratory therapist so that you can get good education on how to control your diabetes and how to use your inhalers appropriately. I put in for the sub-Q heparin as well. I discontinued the telemetry, but we're continuing the pulse ox. And I put in the chain of command that I will be the person on call today. I ordered the Pneumovax vaccine as well. And then what morning labs do you guys want me to order for tomorrow?
Well, since his white count went up today with the steroids, I think we should go ahead and check a CBC in the morning just to monitor that. And since we've started him on some new medicines, I think a renal profile will be appropriate too.
Okay, I will put those in for you.
Great. Mr. Jones, do you have any questions for us? Is there any concerns?
No, just like to go home soon.
Same here. So what we'll do is we'll see you back tomorrow morning,
Okay.
okay? Thank you for letting us meet with you.
Thank you.